Good afternoon.
Good afternoon, Madam Chair.
Good afternoon, committee, and to our guest, welcome to Senate Finance. Today is Tuesday, March 21st. The committee has 10 bills before us for consideration, and they will be heard in the following order. We'll start with Senate Bill 963, 965, 962, 890, 940, 966, 954, 844, 884, 914, and 915. To our guest, we are going to give our sponsors time to introduce the bills. Each of our guests will be given 2 minutes for their testimony. I ask you to be mindful of the committee's time and stay close to that 2-minute timeline. A bell will sound when that time has completed. That is your sign to say thank you very much and end your testimony. Some of our members may be going in and out of the committee room as they have bills to present in other committees. So please don't take this as any disrespect to you or your testimony. It's just in order to get the state's business done, it requires that our members go to the committees of jurisdiction for their bills. So with that, we'll start our hearings today with Senate Bill 963, Transportation Study on Speed Limits, Interstate 495 and Connected Highways. Good afternoon, Senator Benson.
Good afternoon. It sure is nice to be in this wonderful room here where people had to put up with me for about 8 years. It's nice to be here. So thank you all very much. Now, before I start this testimony, let me just tell you all why this piece of legislation is before you. If you get on 495 and proceed, the speed limit is 55 miles an hour. If I go down to 95 toward Richmond, Virginia, the speed limit is 65 miles an hour. If I go up to 70, the speed limit is 65 miles an hour. If I go down Washington-Baltimore Parkway, it's 55 miles an hour. If I get on 70 on my way to my home in Hagerstown, the speed limit is 70 miles an hour. And so this bill that's before you is designed to try to make some sense of what's going on here when it comes to speed. The speed limit changes. So good afternoon, Chair Griffith and Vice Chair Klausmeyer and members of the Finance Committee. I am here to present Senate Bill 963, Transportation Study on Speed Limits, Interstate 495 and Connected Highways. If you have traveled 495, you will understand what I'm getting ready to say. I don't know of a single soul who travels 495 that travels at 55 miles an hour. And if you do, people do things to you like give you the middle finger, they beep their horn, or they'll come up to the back of your bumper and all kinds of stuff. This bill aims to ensure the safety of drivers as they travel on Maryland highways, with over 260,000 people getting stuck in traffic on I-95, 495 every day, and merging congestion leading to accidents on major state highways. It is important to consider consistent highway speed levels to reduce traffic and accidents. In Maryland, there is an average of 110,000 car crashes per year, and this bill aims to help reduce that number. We have to help the drivers within Maryland reduce the impact of emerging between the various state highways. Under this legislation, the Maryland Department of Transportation will conduct a comprehensive study on the effects of speed limit changes in highways in the state that connect I-495. MDOT will consult with local officials and stakeholders who have expertise in traffic safety issues to gather insight on the prevalence of accidents, traffic congestion, and existing speed limits on these highways over the past 5 years. By analyzing this data, we can develop an effective solution to address the concerns of drivers traveling through Maryland. With this study being enacted, we would have the knowledge to tackle and address the speeding and traffic problems of this great state. If enacted, this bill will provide the knowledge needed to create a plan that ensures the safety of all Maryland drivers. I am therefore asking that you please issue a favorable report on Senate Bill 963.
Thank you very much. Are there any questions for the sponsor? Okay, seeing none, that will conclude the hearing on Senate Bill 963. We'll now turn to Senate Bill 965, Breast and Lung Cancer, Establishment of Screening Awareness Program and Insurance Coverage and Cost Sharing. Senator Benson.
Senate Bill 965, Breast and Lung Cancer, Establishment of Screening Awareness Program and Insurance Coverage and Cost Sharing. Good afternoon once again, Chairwoman Griffith, Vice Chair Klossmeyer, members of the Finance Committee. I'm here to present Senate Bill 965, Breast and Lung Cancer, Establishment of Screening Awareness Program and Insurance Coverage and Cost Sharing. The United States of America loses over 47,000 people to breast cancer a year and over 200,000 to lung cancer. Over 500,000 people have been diagnosed with lung cancer at some point in their life. The sad reality is that almost everyone in this room knows someone who has been diagnosed with breast or lung cancer and the stress it causes for families and loved ones. Surviving cancer is half the battle. The other half is the financial burden left on the survivors and their families. And I want to stop and give you a personal note here. For those of you who do not know, this piece of legislation is very personal for me because I am a 38-year cancer survivor. And I recognize without fail that had I not had the proper insurance, I probably would not be here. But this burden, not only financially, but mentally, even fiscally. As a matter of fact, I'm having a niece that's going through this bout with breast cancer as we speak. But here is the saving grace. Treatments like immunotherapy, which is the treatment that cured former President Jimmy Carter's cancer, can be priced around $150,000. Time and money is essential in beating this disease because the cancer may progress while some people try to save money for or locate means to meet their demands, since they cannot afford to undergo all the necessary treatments and screening. And that's what happened with my niece. When she went in, just as an aside, when she went to have her mammogram, there was a small lump in her breast, and it was not considered cancerous. But there was something strange about the lump, and they wanted her to go back and get a second opinion. And she was working for MedStar, and she was participating in a program in Baltimore County. But they told her that in order for her to go back for the second opinion, the insurance that she had was not necessarily going to cover it. And the reason why it wasn't going to be covered is because her income was $1,000 more than what was required for her to get it through the insurance that she had. When Kimmy went back after several months, the lump had grown to be the size of a grapefruit. And when they did the diagnosis, it was cancer. So we as a family had to pitch in to work with her, first of all, with the doctor, a wonderful doctor from Baltimore County. So first of all, they had to reduce, and they had to go through a process. But I'm saying to you all that with this new chemotherapy and they are using it as a trial in Baltimore County right now. On Friday, when Kimmy went back, and guess what? The lump was the cancer was in stage 4. She's been going through this process for 1 year. When she went back Friday, because of this treatment, this new treatment that's coming out that was tried on Jimmy Carter, guess what? Her cancer is gone. To God be all the glory. Lord, I could just scream when I think about it. The purpose of this bill is to establish a breast and lung cancer screening awareness program within the Maryland Department of Health. This legislation would require insurers, nonprofit health service plans, and health maintenance organizations, also known as carriers, to provide coverage for breast cancer diagnosis and associated diagnostic imaging and follow-up diagnostic imaging to assist in the diagnosis of lung cancer, subject to specific cost-sharing limitations. This program will help individuals to be proactive in their cancer journey and provide a sense of financial relief while enduring the gruesome reality of this disease. This is more than a piece of legislation. This is a movement to help save our loved ones and provide financial support during their trying times. And I want to once again reiterate to you all that had Kimmy had the financial means and had she gone back earlier, more than likely they could have removed the lump before it became cancerous. But because she didn't have the financial means and waited until the last minute to inform the family, she ended up with a lump that became the size of a grapefruit. So we had to reduce it. And of course, with the kind of treatment that it was available through this program that she's participating in, as of Friday, the cancer is gone and it's not in her bones. So we as a family celebrated this weekend, and being from a Baptist church, I had to shout for at least 10 minutes. But I'm very grateful. I want you all to know that. I am respectfully urging that the committee take a look at this bill and consider a favorable report on Senate Bill 965. This is not just about breast cancer, it's also about lung cancer, because my beloved husband passed away as a result of lung cancer. So I want to thank you all for your kind attention.
Thank you very much. Are there any questions for the sponsor? Seeing none, that concludes the hearing on Senate Bill 965.
Well, thank you all so much.
Thank you. I think
Oh,
I
thank
saw,
you, Madam Chair. Thank you, Madam Vice Chair.
thank you. I think I saw Senator Zucker come in.
Thank you all very much.
He stepped back out.
Behave yourselves for the rest of the afternoon.
Okay, we're going to skip down the list and we're going to hear Senate Bill 954. And that is the overdose response program, opioid overdose reversal drugs, choice of formulation and dosage. Senator Klausmeier.
Thank you, Madam Chair and committee. It's great to be back today. I'd like to be outside, quite frankly, it's so pretty. Chair Griffith and members of the committee, thank you for the opportunity to present Senate Bill 954. This bill requires the Department of Health to allow an entity provided with opioid reversal drugs through an opioid response program to choose the formulation or dosage of opioid overdose reversal drugs with which the entity is to be provided. This bill is simply about providing access and choice as we continue to combat the opioid epidemic. For returning members of the committee, you may recall that last year we passed legislation known as the STOP Act, to expand community-based naloxone distribution. However, the bill, as it was amended, specified that opioid overdose reversal drugs approved by the FDA for broader distribution through Maryland Department of Health Center for Harm Reduction opioid response programs could only be used if provided by the department. This is the crux of this issue. Although the broader statewide standing order refers to all products currently approved by the FDA, a separate standing order was issued specific to the opioid response program to only allow for the use of Narcan, a 4 milligram nasal spray. At this time, the 4 milligram and the 8 milligram nasal dose of naloxone has been approved by the FDA, as well as intramuscular forms. Last session, we amended the STOP Act to refer to all opioid overdose reversal medications. Our intent was to have patient-centered approaches that allowed treatment providers to determine the medication that is best for the population they are serving. This is exactly what Senate Bill 954 would do. It would provide for choice when providing these medications through approved opioid response programs. Although we have been seeing a decline in the overall number of fatal overdoses, the number of overall deaths involving fentanyl has increased significantly. Data also shows that most fatal overdoses occur in residences where a bystander is present. While this demonstrates a continued need for community-based naloxone distribution, the increased presence of fentanyl has also led to some instances where the need for 2 or more 4 milligram nasal doses of naloxone were used to save a person's life. For this reason, 13 states have already expanded their community-based harm reductions program to include 4 milligrams and 8 milligram nasal doses of naloxone, in addition to the intramuscular forms. On top of that, an 8 milligram nasal dose of naloxone is available in 6 states that provide access to opioid reversal medications outside their health department's program. Our fight in this opioid crisis necessitates all resources be made available. I understand some medications may not be suited for certain populations. We are trying to help. But as we continue to combat this crisis, we need to ensure that the programs have options available to them to best serve their populations they are trying to help. This bill seeks to achieve that goal and provide another tool in our toolbox to save lives of Marylanders. Madam Chair and members of the committee, I urge you to give Senate Bill 954 a favorable report. And here, since nobody else is here, I have my talking points here. MDH's letter, if you read that, raises fiscal concerns. However, the fiscal note indicates expenses may increase minimally. I would also like to point out that the 2-dose kit of Narcan is $45.34 for a total of 8 milligrams, and 2-dose kits of the 8 milligram naloxone nasal spray, Calaxo, for a total of 16 milligram is $57.27. Actually, it makes it less expensive if we go that route. Data also shows that at least 2 4 milligram nasal doses are administered to an individual experiencing an overdose. Using 1 8 milligram nasal dose could be more effective for some population. This is all about choice of what you want to use. Lastly, the broader statewide standing order for naloxone distribution and the standing order for opioid response dispensing have been included as part of my testimony. The standing order for opioid response program dispensing does not include an option for 8 milligram nasal dose. But because some people need two shots of the naloxone. That's what this bill is all about. And it's not saying that every community organization has to order the 8. They can just order the 4. But 2 4s make an 8, the last I heard.
Thank you very much. Are there any questions for the sponsor? Seeing,
And I would be very happy to discuss this with everyone, since it's only me here right now, so. Because that was a lot of 4s and 8s going through this whole thing. It's a little confusing. Okay,
okay, Senator Mounts.
So that MDH is opposing this bill because of the unknown fiscal impact. Have you looked at that?
yeah, yes, I have read it, and that's why I said MDH's letter raises fiscal concerns. However, the fiscal note indicates expenses may increase minimally.
Mhm.
And to save people's lives, come on, you know,
Did the emergency EMS folks comment on the legislation at all?
that I don't know. I was just reading the letters.
Yeah.
But what I said, I would be glad to sit down and go through them and work with anybody who wants to work with me to,
The Maryland Chiefs Sheriff's Association is supporting it,
yes. Yes, I do know that.
and the Association of Counties.
Yes. So MDH is just MDH.
They're wrong.
I'm not saying they're wrong.
I'm
No, I'm not saying they're wrong, but they always have these letters of,
just having fun with the agency in case they're watching. It's, yeah, I get it. Yeah,
no, I
thank you.
mean, they do have that. Well, for me, they have that reputation, so
Thank
they
you.
mess with you.
All right, I see no further questions for the sponsor, so that will conclude the hearing on Senate Bill 954. I see we have Senator Zucker is back, so we're going to bring him forward and here's Senate Bill 890, Maryland Department of Health 211, Maryland Oversight. Good afternoon.
Good afternoon, Madam Chair, distinguished members of the Senate Finance Committee. It's also during this time at session that I realize how out of shape I am, running back and forth, but all good. It's good to see you all. Madam Chair, this is a direct cross-file of the House Bill 340, which passed unanimously out of the House and is now in this committee's possession. This really does 2 things. It modifies the definition of Health and Human Services referral system, and then also working with the administration, the Maryland Department of Health. It, I guess it limits some bureaucracy where the Maryland Department, it gives more autonomy to the 211 board since they're involved with the Jamie Raskin Act and all these other things. It just gives, it gives them more autonomy. And this is with the advice and counsel of the Maryland Department of Health. I would ask for a favor report and happy to answer any questions and appreciate your time.
Thank you very much. Are there any questions for the sponsor? Seeing none, that concludes the hearing on Senate
you.
Bill 890. All right, we're going to move through our schedule. We're going to turn to Senate Bill 940. Senator Muse is presenting prescription drugs, accessible labels for blind, visually impaired, and print disabled individuals. And he is bringing with him one witness, Ronza Othman.
Yes.
Good afternoon.
Good afternoon, and thank you very much, Chairwoman Griffith and Vice Chair Klaus Meyer and members of the Senate Finance Committee. Thank you very much. I want to first say that all the parties that were involved in this legislation, the National Federation of the Blind, and this is Senate Bill 940, and for the record, I'm seeing Anthony Muse and Senate 26th District. It's 940, prescription drugs, accessible labels for blind, visually impaired, and print disabled individuals. All the parties that were involved in this legislation, the National Federation of the Blind of Maryland, the Maryland Pharmacy Association, and the Maryland Association of Chain Drugstores have all worked together for many compromises that were made on both sides to reach the agreement that led to this legislation. There's some amendments that you have before you today, and I'll refer to them in a moment, that the House adopted unanimously on March 18th. So SB 940 as amended will require the pharmacy board to ensure that blind, visually impaired, and print disabled Marylanders are informed about the availability of accessible prescription labels. So this bill as amended would also require pharmacies to implement a program to provide upon request to blind, visually impaired, and low vision Marylanders an accessible label that meets their needs for extra large print, audio, or braille. Pharmacies will provide these labels at no additional cost to patients and at a comparable time to those without disabilities receiving medication from those pharmacies. The regulations adopted under this bill as amended will follow guidelines and recommendations in the prescription drug labels, actions needed to increase awareness for best practices for impaired report issued by the U.S. Government Accountability and from that office there. Now, why is this needed? It's needed because currently the visually impaired community is at high risk for medication errors, such as taking the wrong pills, the wrong dose, drug administration errors occur. And this is a simple intervention that can prevent potentially devastating outcomes. The bill as amended not only gives notice of accessibility, but ensures that individuals that request it are informed about these options available, choose the one that suits their needs, and ensures that the blind and visually impaired individuals receive the same quality of prescription instruction and warnings as everyone else. So this bill as amended will also directly benefit vulnerable populations by increasing the accessibility of prescription instruction labels by not only requiring these pharmacies provide accessible options, but also by requiring that pharmacists verbally inform customers that various accessible label options are available. The bill directly impacts many low-income individuals who are often unable to receive adequate assistance for visually impaired due to lack of insurance or resources, as well as elderly patients who also experience these challenges due to age-based vision loss. Several large retail pharmacies, as well as smaller pharmacies, offer accessible prescription labels, including CVS, Walgreens, Walmart, Sam's Club, Rite Aid, and others, but it is not consistent. It is not consistently available across the board and needs to be. Therefore, with the legislation that we have here, for all these reasons I've stated and more, I urge a favorable report for SB 940 as amended. And again, Mrs. Othman is here, the president of the National Federation of the Blind of Maryland. There are those who are behind us who are also in support of this legislation, who have come down just to be present so that you will see that many are concerned about this. So thank you. And with that, I'll stop for any questions that you may have. And if I can't answer it, I'll turn it over to Ms. Othman, who is more than able.
Thank you very much. Are there questions for the sponsor? I do have a question, and thank you, Senator, for presenting the bill. I note that if I'm reading the file correctly, it looks like the House adopted some amendments to the bill. Have you all had an opportunity to review them? Maybe Ms. Othman, and you want to speak to that?
Yeah. Thank you. Thank you so much. The amendments that the House adopted are what the interested parties, including advocates and the Pharmacy Association, the Retail Association, agreed upon in negotiations with Senator Muse and Delegate Guyton, who has the cross-file bill in the House, which was adopted by the full House and is now before you as well. And so we are happy with those amendments. The amendment you have in your packet from Senator Muse should match the House version exactly.
Thank you very much.
Did you need me to explain them at all? or-
Nope, I do.
Okay.
I do have them and went through
Great.
them. I don't see any additional questions from the committee, so we thank you very much for your testimony, and that concludes the hearing on Senate Bill 940.
Thank you, Madam Chair. As I always say, always good to be back in my committee where I served 8 years and sit right along here, and thank you for the job. you're
Well,
doing.
thank you. Please don't go far, Senator, because we're now going to turn to Senate Bill 966, which is Prince George's County Work Group on Health and Wellness. And that is another Senator Muse bill.
Thank you. And if you don't mind, Madam Chair, I'm going to ask if my legislative aide will present the bill. She's going to present the bill. I'm not going to bother with this, just to say that this bill, as you know, was passed unanimously by our local delegation. It is a local bill. And more so, we have the support and letter from county executive. And I want to present Brandy Calhoun. She's going to do that. You know, once a senator, always.
Thank you, Senator Muse. Good afternoon, Chairwoman Griffith, Vice Chairwoman Klossmeyer, and members of the Senate Finance Committee. My name again is Brandy Calhoun. I am Senator Muse's Legislative Director. And like you said, I'll be presenting Senate Bill 966. Senate Bill 966 would establish a Prince George's County Health and Wellness Work Group. The work group would consist of the following members: the chair of the Prince George's Senate Delegation, the chair of the Prince George's House Delegation, the chair of the Prince George's County Council, and the following members will be appointed by the Prince George's County Senate Delegation: 2 representatives from a small and local health and wellness business, 1 integrative health and wellness practitioner, and the county executive would be able to also appoint members. 1 would be a certified dietitian, 2 health and wellness practitioners in Prince George's County, and 1 representative of the Prince George's County Food and Equity Council. There's an amendment in your package that would add the Prince George's nonprofit as a member of the work group. They have requested to be added to the work group, and we would love for them to be a part of this. And as it relates to the health and wellness of our state, I hope some of you will agree with me that our focus is on disease management, specifically in the Black and Brown communities. And many of the diseases that we are managing are related to the lack of education and limited options and resources. Therefore, Senate Bill 966 will require the work group to review the availability of health and wellness practices in our county, the available options for integrative health and wellness programs in the county, and review programs that promote healthy eating within the county's government agencies. After reviewing these programs, the work group would be tasked with making recommendations regarding the best practices in the health and wellness community, including strategies and the programs that, number 1, promote healthy eating, number 2, improve equitable access to healthy, affordable, and accessible food retailers, improve access to gyms, rec centers, playgrounds, biking, walking paths, promote healthy eating, physical activity, and healthy habits to prevent obesity. The work group will also make recommendations for incentives that may be provided to employers who promote health and wellness strategies. Further, the work group will review, report, and evaluate the benefits and feasibility of integrative health and creating integrative health and wellness hubs in Prince George's County. Also, there's another amendment that strikes the University of Maryland system as the staff and replaces it with the Maryland Department of Health in cooperation with the Prince George's County Health Department. The work group will report the findings by December 2024. And in closing, I don't know all the answers, and Senator Muse doesn't know all the answers, but I do know that we are in a health crisis in Prince George's County. In fact, according to Harvard School of Health, 1 in 6 children are obese, 1 out of 3 children are overweight or obese. Unfortunately, there are several factors, but one factor is lack of education. Lastly, I read something from the World Health Organization the other day, and the title of their post was Healthy Cities: How award-winning cities around the world are leading the fight against non-communicable diseases and injuries. In fact, there was a city that was highlighted for promoting healthy eating through nutritional standards, salt reduction, and healthy canteens, which will improve access to nutritious foods for all. My point with sharing this information is that we have the opportunity to make Prince George's County a model for other jurisdictions to follow. Prince George's County has the opportunity to be the leader in health and wellness. Therefore, it is for all these reasons and many more that I urge and ask this body for a favorable report for Senate Bill 966 as amended.
Thank you very much. I see no questions from the committee. So that concludes the hearing on Senate Bill 966. Thank you very
Thank you.
much.
Thank you. Wish you all the best for these next few days.
Thank you. Colleagues, we're going to turn to Senate Bill 962, the Anne Arundel County Alcoholic Beverage License Residency Requirements, and this is Senator Beidle.
Thank you, Madam Chair, Madam Vice Chair, members of the committee. Senate Bill 962, Anne Arundel County Alcoholic Beverage Licenses, is a bill that you've heard from other counties. So it's a local bill. And what it really does is it says, in order to get a liquor license in Anne Arundel County, you do not need to be a resident of the county, but you need to be a resident of the state. And if you move out of the state, then you give up your liquor license. You've heard it from other counties. There is an amendment requesting that this be a delegation bill with a letter from the delegation supporting Senate Bill 962.
Thank you very much. See no questions from the committee, so that concludes the hearing on Senate Bill 962.
Thank you, Madam Chair.
Thank you, Senator. All right, we're going to have to pause for just a moment while one of our colleagues makes it down the hall from their committee room, and then we'll take the next, or we could go to Senator Ellis. Oh, he's ready. Well, then let's go to Senate Bill 915. Senate Bill 915 is Railroad Company Movement of Freight Required Crew, and that is Senator Ellis.
Thank you, Madam Chair and members of the Finance Committee. I'm Arthur Ellis, Senator from Charles County, here to present Senate Bill 915, requirement of crew requiring freight companies to have two workers, crew members on a freight train. Since I am not an expert on trains and locomotives, and I'm not allowed to have any witnesses, I would love to read the testimony that's submitted to the committee from an expert chair of the Brotherhood of Locomotive Engineers and Trainmen. Today, we offer our full support for SB 915 and encourage the committee to give your favorable approval. The legislation will establish a minimal two-person safety standard for freight trains operated in the state of Maryland. In the absence of federal regulations and legislation on this important public safety issue, the responsibility to protect the towns and communities along Maryland's railroad network falls to us, the Finance Committee and the Maryland Legislature. Going back a few weeks ago, we all saw a video of that train going down the tracks in Ohio. The one that derailed caused a toxic leakage of chemicals. The funny thing is, the video showed in the rear of the train cars sparking fire. It was nighttime. Now that was train operated. It was a very long train. Imagine no one there in the back. Usually the person in the back, called in the caboose, could look out and see what was going on and cause major chaos there in the town of Palestine, Ohio. And everyone's pointing fingers being pointed that the last administration, federal administration, they gutted railroad standards. But the key is the regulations, laws currently allow companies, rail companies, freight companies, just to have a one-person crew member on these long freight trains. And these trains pass through our great state of Maryland. So secondly, getting back to the testimony, secondly, our approval of this legislation is not preempted by federal law or any collective bargaining agreement. In 2021, the Ninth Circuit Court of Appeals ruled against the FRA, Federal Railroad Administration, and rail carriers in a case brought by the states of California, Washington, Nevada, that attempted to preempt state crew size laws. The Court of Appeals ruled that attempts by the Federal Rail Administration to preempt state laws enacted to establish minimum crew size was arbitrary and capricious and challenged assertions by the FRA and rail carriers. Reducing the number of crew members in the cab to one person could improve safety, quote, did not withstand scrutiny, unquote, and was lacking. Third, your support and approval of this legislation will not only improve safety on the freight rail system, but also improve passenger and commuter rail safety. I would want to say, since we get put in this bill passed General Assembly in 2019 and was vetoed by the then governor. And here we are again, trying to get this through. Let's get to Maryland. Maryland has over 770 miles of railroad owned by called Class 1 railroads, Norfolk Southern, CSX, and Amtrak. An overlay of the state rail network shows the most populated and traveled passenger and commuter rail corridors are also the main ones, north-south and east-west. High-speed passenger trains, Acela, regional intercities share the same rail corridors with mixed rate and unit trains. The commingled and shared freight and passenger corridors place greater importance on this legislation for the safety of the traveling public and railroad network. Maryland also hosts two of the busiest passenger rail stations in the entire Amtrak system. Baltimore Penn Station and BWI Marshall Airport ranked 8th and 14th respectively. An average of 1.8 million travelers and commuters annually utilize the Aberdeen, Baltimore, Cumberland, Rockville, New Carrollton, and BWI Marshall Airport stations. Their future population growth and the density will continue to increase. I'll skip that part. Let's get to the end of the testimony. It says, let's prevent the next tragedy. You have the opportunity to prevent a major railroad accident in Maryland. We have witnessed the tragedy and devastation occur in a single-person rail operations in Quebec, Canada, back in 2013. It was bad, killed 47 people, a lot of discharged chemicals. Fast forward to the most recent major train derailment, freight train derailment on February 3, 2023, the derailment of a Norfolk Southern train in Palestine, Ohio. The crew members there were able to notify officials quickly, help to mitigate damage and injury to life. And the impact was minimized because they had 3 people on that train, 3 crew members. In conclusion, I will summarize my testimony saying this is very important. This bill will not add any additional costs to the rail companies because this bill requires Maryland to reimburse the freight operators for the second person on the crew. And there's a fiscal note, I believe, of $3 million per year for that. So as such, Madam Chair, Vice Chair, and committee members, ask for a favorable report on this bill. And I must also add that it passed the House and the House version is sitting in this committee to be heard. Thank you, Madam Chair.
Thank you. Senator Bidel.
Thank you, Madam Chair. So Senator Ellis, thank you for this bill. It's been introduced multiple times. When I served in the House in Environment and Transportation, I think we had it every year for 4 years from 2014 to 2018. And I'm very pleased to see it pass the House this year, 107 to 28. It often didn't get a vote in the House. But I think after the terrible incident in Ohio, it's really time to look closely at this. And thank you for bringing the legislation again.
Thank you.
Thank you. Senator Kramer.
Thank you, Madam Chair. And I echo Senator Bidel's comments about good to see this bill finally pass. This is about safety. And we are seeing nearly weekly news reports about significant failures in our railroad systems because of a lack of safety precautions. What disappoints me is that apparently the prior administration signed this agreement with an entity that makes millions of dollars in the railroad business, that now the state's on the hook for paying costs, common sense safety costs that now have been passed on to the state. And I'm disappointed to see that the immediately prior administration saw fit to decide that Maryland taxpayers would pay for this instead of the entity profiting. But having said that, it is important enough that we should get it passed, and perhaps in the future look to see that the entity that's getting the profit from its business here in the state actually covers the cost, the nominal cost to them for providing common sense safety measures. So thank you for bringing the bill, Senator.
Thank you.
Thank you. Senator Mounts, then Senator Reedy.
And I apologize. I was reading the testimony and I've got a specific question about what rail lines are covered by this? Which lines are the ones would this apply to? Is it all freight hauling
All,
operations?
all freight trains going through Maryland.
And they have to be interstate?
Well, doesn't matter where I think it doesn't matter where they come from. If they're going through Maryland, as soon as they enter Maryland, whether it's from Pennsylvania or from West Virginia, or from Virginia coming from the south, they have to have a 2-person crew. And I would imagine if that freight train originates at the port of Baltimore and load up with cars or whatever, they have to have a 2-person crew because they are in Maryland and they will traverse the Maryland rail tracks.
On the Eastern Shore, the state has pulled away from a lot of our rails. They're obsolete. The last piece was a very important stretch of rail out in Dorchester County by Cambridge. However, there still is an existing Maryland-Delaware Railroad. And I'm not sure exactly specifically, I don't believe they're hauling anything toxic. I haven't consulted with them, and I'm going to ask them about it. And they're probably going to ask me, well, Johnny, what does this apply to? So I will just confirm anybody hauling freight would be covered by this. And I don't know what their response will be.
Yes, all freight trains. We will not, this bill doesn't call for us to ask, what's on the trains, the toxic is not. And if therefore if it is, then you need a 2-person crew. No, if it's a freight train going through Maryland, it needs a 2-person crew.
Thank you.
Thank you.
Welcome.
Senator Reedy.
Thank you, Madam Chair. So quick question, would it be the case that if we pass this, that a train would have to stop in Maryland, add somebody and then let them off before they leave Maryland because the surrounding states don't have this law, or do the surrounding states have this law?
Well, I think 19 states have this law, but I don't think Virginia or Delaware
Or West
were on the
Virginia?
list. So I can research that.
Okay.
But the key is, they could have the second person join the train at the source, whether it's in Western Pennsylvania or New York. It doesn't have to stop. Basically, they could have that person on. But the key is, as soon as they enter Maryland Rail Network, that second person needs to be on the freight train.
Yes, okay. My understanding, speaking to what Senator Kramer talked about, my understanding was that if we had passed this before, it was going to keep us from getting the big tunnel redone in Baltimore because of a federal law issue.
Okay.
It wasn't maybe necessarily the previous governor's disregard for human life. It was actually more of a issue of federal law and it affecting, but I may not be remembering clearly. I wasn't on the committee at the time.
Yeah, so I think I covered that in my testimony, saying that this bill will not violate any federal laws or regulations.
It won't violate federal preemption on rail?
It will not,
Can you
correct.
repeat to me why? I mean, I guess I can read the testimony, but why won't it violate?
Well, I'm not prepared to answer that why question,
Okay.
to be honest.
Okay.
I can
I'll
get
take a
back
look.
to you with
Yeah.
that.
No, that's
but,
fine. Thank you.
It's fair. See no further questions from the committee. We thank you very much for your testimony. That concludes the hearing on Senate Bill 215. We'll now turn to Senate Bill, I'm sorry, 915. We'll now turn to Senate Bill 914, which is hospitals, overdoses, testing for fentanyl.
Okay.
And that is
Great, thank
also
you.
Senator Ellis.
Okay. Let me get my paperwork together here, Madam Chair. Let's see. Good afternoon, Madam Chair and Vice Chair, committee members. I'm Arthur Ellis, here to present, Senator from District 28, present Senate Bill 914, requiring hospitals to test for fentanyl when overdose cases come into the hospital. Before I begin my testimony, I want to just tell a little story. A constituent enrolled me, a mom trying to get her son out of the home into the military, and he had some prior marijuana use, which is forgivable in the military if the applicants meet certain standards. So this young man thought he used marijuana. When he went in and tested, they found fentanyl. He's like, wait a minute, I didn't knowingly use that. Fentanyl is being placed in other drugs being laced with fentanyl. Unknowing to a lot of individuals, they are ingesting fentanyl when they take what they think is legal substances, which the voters of Maryland made marijuana, which is, what's the term now? Cannabis legal. So you know, there we have that. We have that issue deal with and the constituent issue, and it's so prevalent now. So this bill will help patients know basically if they're going through a overdose situation in the hospital, what substances are impacting their health. Currently, hospitals are not testing for fentanyl. According to a study conducted by University of Maryland Center for Abuse and Research, Substance Abuse and Research, only 5% of overdose patients are tested for fentanyl when they seek medical attention at a hospital. This is despite fentanyl being the #1 killer of Americans aged 18 to 45, and the fact that more than 80% of the recent fatal overdoses in Maryland are fentanyl related. When the hospitals do test for fentanyl, it has a near 50% positivity rate. So this is that we are dramatically underestimating the drug's prevalence in our communities. Again, since I'm not an expert in the drug abuse category and fentanyl, I chose one of the best testimony that's in your records for this bill, Senate Bill 914, and from Ms. Yates, who's a University of Maryland School of Social Worker graduate student. Fentanyl continues to show up increasingly more in drugs. Even as hospitals fail to standardize fentanyl screening, the drug commonly appears in substances like cocaine and fake pills. This means that more patients will seek medical attention for what they think is a bad reaction to a less dangerous recreational drug like cannabis, but could instead be experiencing a fentanyl overdose. But I also mentioned that the crossfire for this bill, the House bill, passed the House unanimously 132-0 and is now in our committee. So we have the solution here. Part of the solution is how SB 914 and HB 811 will close the fentanyl testing gap and why it matters. Fentanyl testing will provide more accurate data on overdoses in Maryland. The Maryland Opioid Recreational Command Center collects data on fatal and non-fatal drug overdoses in Maryland. This data comes from hospitals. If we are not testing for fentanyl, then we are undercounting the overdoses that's happening. Data collected is de-identified and is only represented by a diagnostic code that indicates a positive or negative, and that hospital where the results came from. That means that this data will not carry an individual's name, and no one will be able to say, hey, John Doe tested positive for fentanyl in the reported data stream. This data is needed for officials to create programs and interventions that can proactively treat the opioid crisis in Maryland. If we're not collecting the correct data, then we cannot create effective solutions. I could go on, but I think I have hit the core parts of this bill. And I would love to introduce, Madam Chair and committee member, gentleman who worked very hard on this bill. William O'Malley is here. And Mr. O'Malley is a former first son in Annapolis here. So I thank him for his advocacy for his work. And committee members, I ask for a favorable report on Senate Bill 914.
Thank you, Senator. I just have one quick question. I looked at the folder and the testimony, and thank you for drawing our attention to that. I just had noted on the House bill, they had some amendments. I don't know if you had a chance to take a look at those.
Yes, I sure did.
And are you supportive of the bill as it left the House?
Yes, I am.
Okay,
Yes.
very good.
Yes, and I will submit the amendments to council.
Very good.
Yeah.
Excellent.
Thank you.
Okay, I see no further questions from the committee, so that will conclude the hearing on Senate Bill 914. Colleagues will now turn to Senate Bill 884, Maryland Department of Health Work Group to study the establishment of an affordable assisted living enhanced care program. Senator Washington.
Thank you. Thank you, colleagues. Thank you, committee. Thank you, Madam Chair. This bill is actually a redrafting of a bill that some of you may have seen late in session last year, which was to establish a pilot program to explore funding and supporting and the establishment of an affordable assisted living and enhanced care program. And the goal of the original bill was to recognize that, as it says in the preamble, that our aging population, because I'm a part of that, over 60, is growing or has grown or will grow from 2015 to 2030, 40%. And even in the last few years, it has increased by 27%. And individuals over the age of 85, in terms of people coming to Maryland, and in fact, into particular counties, is the fastest growing segment. Now, we also have to take into account that at the same time, there are different needs in that population. Many need assisted living, some living with daily life activities. Another subset needs full healthcare nursing care. Now, when we're looking at the population that lives in assisted living, right, only about 18% of assisted living beds that we have are Medicaid certified. And moreover, the number of Medicaid certified assisted living beds in the state actually has decreased since 2019. So what this bill lays out is asking us to study, or actually I have amendments if you're so inclined to actually institute the pilot, but to really look at this issue of how do we address both the housing and the healthcare needs of older adults and seniors. And how do we potentially decrease the costs that Medicaid pays to full-on nursing homes? Okay, so full-on nursing home care costs more, right, than assisted living care. Additionally, if you look at the data, individuals who are able to live in assisted living and have some kind of way to support their healthcare needs, And while their healthcare needs aren't as drastic as those that need full-on nursing, if we're able to have an intervention that supports their daily living needs, it will reduce the likelihood that they'll have greater need. So there's three parts of this sort of issue. One, we have a growing population. We have a population that is going to need our traditional nursing home care that is funded through Medicaid. Okay, so that's at a point where people need full on or 24-hour support. We have these community care programs that can fund individuals who are living in assisted living, but they have to have really a lot of great need. But we don't have a good funding mechanism to support individuals that are living in assisted living and just need some help. Now, some states one state in particular, Illinois, has implemented a enhanced Medicaid program that provides assisted living support for individuals. And they calculated that the state was able to save between $104 and $150 million annually by keeping people out of nursing homes. Okay, so that, I guess in a nutshell, is the bill or is the issue before us, that we have this need, it's not funded, we don't have a good mechanism, the population in need of some type of support for their daily living, but daily living actually is healthcare. You need to be able to, prepare your foods, perhaps sometimes have some guidance and support in your daily activities, making sure that your diet is proper. And we need to specifically look at people who are at the sort of that middle income. So the bill is written before you as a work group. Now, certainly, if you were to accept the amendments, which I think are before you, that would add a significant appropriation. But I will put forward, however, as the committee pleases, that at the very least, we contemplate a summer study. I say a summer study that looks at this issue, looks at the opportunity to how we can leverage Medicaid dollars. Additionally, if we leverage these Medicaid dollars and we can create more opportunity for individuals to live in assisted living, we can also create an opportunity to leverage housing dollars to fund the creation of these assisted living scenarios. Because at the moment, one could build an assisted living home or complex or apartment, but there wouldn't be a funding mechanism that would allow people to live there affordably. So I appreciate your time and your consideration. I look forward to a favorable report, and I'm here to answer your questions.
Thank you very much. I don't see any questions from the committee. And so that will conclude the hearing on Senate Bill 884. Colleagues, I believe that is our final bill for today. So I would like to prolong our time together, just having a conversation about I'm just kidding. Meeting adjourned.